Dengue Fever Outbreak 2025. What you must know now. Symptoms, risk, and how to stay safe. You're feeling tired, feverish. Maybe a rash shows up. You think it's the flu or just stress. But what if it's something far more dangerous? Right now in 2025, dengue fever is exploding across cities and rural communities alike. And here's the scary part. One mosquito bite is all it takes. Hospitals are seeing more cases than ever before, and most people don't even realize they've been infected until it's almost too late. So today on ACE Healthline, we're breaking down what dengue fever really is, why it's spreading so fast, and what you must do right now to stay safe. What is dengue fever? Dengue fever is a viral infection spread by the Aedes mosquito, the same mosquito that's active during the daylight hours. Yes, not at night like malaria. This mosquito bites and spreads 4 different strains of the dengue virus, meaning even if you survive one infection, you're not immune from the others. And the second time around could be much worse. Doctors call it breakbone fever for a reason. The symptoms can be extremely painful, affecting your joints, muscles, and even causing internal bleeding in severe cases. And with rising temperatures and stagnant water everywhere, from gutters to buckets, we're giving mosquitoes the perfect breeding ground. Symptoms. What to watch for. Here's what makes dengue so dangerous. The early symptoms are so common, they're easy to miss. Watch out for high fever, sudden and intense, severe headaches, especially behind the eyes, muscle and joint pain, skin rashes, nausea or vomiting, and in more severe cases, bleeding gums, nosebleeds, and blood in urine or stool. These symptoms usually appear 4 to 10 days after the mosquito bite, and the fever can last up to a week. But even after the fever breaks, you might feel drained for weeks. If someone starts bleeding or has difficulty breathing, go to a hospital immediately. That could be dengue hemorrhagic fever, a deadly form of the disease. Why it's spreading faster in 2025? Experts are sounding the alarm this year because rainy seasons are longer and heavier. Poor drainage systems create standing water. People store water in open containers during power and water outages. Climate change is increasing mosquito populations in new regions. This isn't just affecting tropical countries anymore. Dengue is showing up in urban areas, suburbs, and even places where it never existed before. And since there's no specific cure for dengue, prevention is your best defense. How to protect yourself and your family. Here's what you should do right now. 1. Eliminate standing water around your home. That includes buckets, flower pots, old tires, and even bottle caps. 2. Use mosquito nets and screens, especially during the day when Aedes mosquitoes bite. 3. Wear long sleeves and trousers when outdoors. Light-colored clothing helps repel mosquitoes. Apply mosquito repellent that contains DEET, picaridin, or lemon eucalyptus oil. 5. Use indoor insecticides or mosquito coils, especially during the day when Aedes is most active. 6. Watch out for community outbreaks. If your area is reporting cases, increase your protection immediately. 7. Seek medical help early if you or your child develops a high fever with any of the symptoms mentioned earlier. Final thoughts. Dengue isn't just another tropical disease. In 2025, it's becoming a global health threat, and it could affect anyone. One bite, one mosquito, that's all it takes. The good news? You're not powerless. By staying informed and taking smart precautions, you can protect yourself and your loved ones from this painful and potentially deadly virus. Don't wait until someone you love is hospitalized. Share this video, take action today, and join us on ACE Healthline every week as we break down critical health threats and life-saving tips in a way that's easy to understand.